For more on the impact of reopening businesses, we're joined by Rafael Perez-Escamilla. He's a professor at the Yale School of Public Health. I saw in The Atlantic, they had a headline of a story, Americans are done with the coronavirus. The virus is not done with us. A lot of people pretending the pandemic is over, and we're seeing this, I don't think, just in the United States, other places as well. What are the risks of that?
Well, Mike, first of all, thanks for having me in your program. The risks are huge because there is now a false sense of security, as if the virus has also gone on summer vacation here in the US and in the northern hemisphere, and that is very far from the truth. The fact that we have had to reopen some countries and some states while the number of cases and hospitalizations were still climbing indicates that we need to continue to be super vigilant, and the governments need to offer to the citizens enough testing, contact tracing, and opportunity to quarantine to prevent major spikes or major rebounds with regards to the COVID-19 pandemic.
Rafael, talk to me about areas of concern in the world right now. I know Brazil's had this enormous amount of cases. We're seeing in Bolivia where there's concerns of collapse of hospitals. What areas of the world are you looking at with particular concern at this point?
So by far, right now, Latin America has become the new epicenter or hotspot. In addition to Brazil, Bolivia, Peru, Mexico is facing a very dire situation. And they are trying to do the best they can with the limited resources that they have, and taking into account the fact that over half of their populations rely on the informal economy and have no social security or unemployment protection. They need to balance the public health risks against the total economic collapse. And unfortunately, none of both of the sides of this coin are being addressed properly by several governments in Latin America.
Well, you're talking about Latin America. Jair Bolsonaro has pretty much downplayed this, but as has the United States president today. He said, if we stop testing right now, we'd have very few cases, if any. He's planning to hold a rally in Tulsa. He's hoping to pack it in with people, and he's thinking of doing more of that. Talk to me about your concerns there.
So that is a very classical example of how politics are actually leading to major health risks and a very high degree of unnecessary mortality. So in addition to the wishes right now of the leader of the US to start having political rallies again, he has downplayed the role of masks. He downplayed for a very long time, for many, many weeks, crucial weeks, actually the even presence of the virus in the US territory. And also he has been proposing very, very strange potential treatments against the disease that are totally dangerous. Not only they are not effective. So that is exactly the wrong type of leadership that the world needs now to fight this pandemic.
Rafael, we've been dealing with this coronavirus for some time now. What are some of the things that really stand out for you? I was just reading an article this weekend, you know, all these young people in their 30s still dealing with post-viral fatigue months after contracting the virus. This is really a nasty virus, isn't it?
It is a very nasty virus. It is a virus that has had its first encounter, as far as we know, with human beings. That means that human bodies are not very sure how to handle it, and almost every day or on a weekly basis we learn more nasty side effects from this virus that not only attacks the lungs, but it also attacks many other tissues in the body among different individuals, including the kidneys, including the heart, and including a major inflammation in the blood vessels. So it should be taken very, very seriously. And it is looking like until we have a very effective vaccine that can be distributed globally, we're just not going to be out of the woods. And that is a reality. And that's what we should be conveying to the whole population, that if we practice social distancing, if we use the masks, if we avoid major indoor events, and the countries invest in contact tracing, obviously enough testing, and ability for people to quarantine, what we have seen in Beijing is exactly the way to respond. When just a few dozen cases are detected, they are detected before they even arrive to the hospitals, and there is still time to stop the spread to a very large number of citizens in a very short period of time.
Rafael, thanks so much for your insights. Really appreciate it.